Welcome to Western Wisconsin Journal. I'm your host, Meg Heaton. And for close to 70 years, Hudson Hospital has been an important part of the community and continues that role today, especially helping us navigate our most recent serious health challenge, probably in recent history. My guest today is Tom Borowski, the president of Hudson Hospital and Clinics, now a Health Partners facility. He is here to talk about our hospital, where we are with COVID-19, what the affiliation with Health Partners means for the community healthcare, and what's the future for Hudson Hospital Clinic, or Hudson Hospital and Clinics. Welcome, Tom. Thanks for being with us.
Thank you, Meg. It's a pleasure to be here.
Let's get started with getting to know a little bit more about your background, how you came to be in Hudson.
Yeah, so Meg, I've been originally from Marshfield, Wisconsin, and I've been in healthcare leadership for about 3 decades now. Previously, I was with Mayo Clinic Health System, with the Marshfield Clinic System, with Alina, and all great healthcare systems. And I joined Health Partners in Hudson Hospital and Clinic about 4 years ago, just over 4 years actually. And I've seen just a tremendous amount of growth here since the time that I've been here. What I will say is my wife, Mary, and I and our family, we absolutely love Hudson. It's such a nice and safe and pleasant and vibrant community, and plenty of things to do here as well. So it also has everything that we could ever want or need here. I've also been very, very happy since I joined Health Partners in Hudson Hospital. The career here, the culture, everybody here, it's like family. It's just fantastic. It's everything that we'd ever hoped it would be. So we plan to make Hudson our home for a long time, and we're proud to call it our home as well.
Great, great. I'm glad to hear that. Why don't we just get started and get the COVID information out of the way right away, since that's foremost on a lot of people's minds. What's the transmission like in the community right now?
Yeah, our transmission right now, I would say, is we've heard lots of reports nationally that the latest surge is starting to slow down. Today, we still have a high number of patients that are testing positive for COVID, who are also being hospitalized for COVID. So it's important to remember for our viewers here that COVID is still spreading locally. Thankfully, the number of cases is trending downward, but people should be cautious because COVID can be dangerous, particularly with those who have underlying health conditions. So it's present, it's slowing down, but we're not out of the woods yet.
In terms of the capacity at the hospital, a couple of weeks ago, we turned on the nightly news and saw Hudson Hospital was at capacity. And I think people got a little alarmed because they hadn't been following it that closely. Where are you at now in terms of the hospital census with COVID patients?
I'm so glad you asked that question, because I think there is somewhat of a misunderstanding, and we are very, very busy at the hospital right now. On most days, our inpatient beds are at full staff capacity, but that's not because of COVID. Right now, the number of COVID patients we have in the hospital has ranged from just a few to about half of our patients during the peak of COVID. Right now, we're only averaging about 2 to 4 patients who are hospitalized for COVID right now. So it's not even a quarter of our total patients right now. It is subsiding, but again, it's still very serious. So it does merit mentioning that the majority of our patients who have been hospitalized for COVID are unvaccinated. So I need to put this plug in since I have the opportunity. The majority of our patients, the vast majority, over 90%, who are hospitalized with COVID are unvaccinated. So just another reminder of the importance of getting a vaccine and taking those precautions for yourself and your loved ones.
And just so in case people who don't know, what is the bed capacity of Hudson Hospital?
We are licensed for as a critical access hospital, which means we're licensed for 25 beds. Our staffed capacity is typically around 14 to 15, upwards of 16 patients. Okay. That has to do with staffing requirements.
Okay. And then to get back to that all-important vaccination question, where are we in our community? Do you have those numbers as to how many people in our community are vaccinated, and how we compare to the state overall in Minnesota?
Yeah, when you look at the latest numbers as they're trending locally and regionally, again, those numbers are, it's hard to do a comparison when you look at across the region, but we're fairly typical of what you would find in the Midwest right now. Right now, we're at about just slightly above 50% for vaccination rate within the community. Of course, that means that there's lots of folks who haven't gotten the vaccine, and we're encouraging them to do so. But it's roughly about half who've not gotten the vaccine, but the transmission, as I mentioned, is starting to slow down a little bit, but we're still busy at the hospital. We are still seeing patients at the hospital.
Right. What is the, in terms of the employee vaccination, what has Health Partners implemented a policy about vaccines and testing?
We have, like many of the other healthcare systems in our area and around the country, we do have vaccine requirements for COVID and for other viruses. All employees at Health Partners must be vaccinated or have an approved exemption for either a healthcare reason or for religious reasons. And over the last several weeks, we focused on helping educate our colleagues about the benefits and safety of these vaccines in order to make informed decisions. I'm happy to report that all of our staff that work here at the hospital and the clinic have complied with the vaccine program requirements, meaning that they are either vaccinated or they do have an exemption that's approved. And we're not offering the testing option for our employees as a means to work here. As of last week, I was looking at a stat here, 99% of our Health Partners employees have been vaccinated against COVID or received an exemption. This is important because we know that the vaccines are protecting our workforce as well as our patients, our family, and loved ones. So we are 100% compliant here at the hospital and clinic with that program. And right now we're about 99% at Health Partners. So we're getting there. And just want to give the assurance to everybody in the community, if they're nervous about coming here, we take safety very serious here, and no need to worry about that.
That's great news. In terms of the booster shots that are becoming available, I know that the clinic is offering both the Moderna and Pfizer now to the over 65 and people who are compromised. Is that going to be going forward for everybody?
Yeah, right now the boosters are not required for our staff. That's certainly up to the discretion of patients. We do encourage them to speak with their physician about getting a booster. We do offer the booster shots by appointment only. In the past, we had the open COVID clinic for vaccines. Today, you can get your flu shots or your booster shots for COVID via an appointment with your physician here at the hospital.
And what do you anticipate in terms of if hopefully the CDC will be approving the 5 to 12 age group for shots? Will they be available through the clinic as well in the hospital?
I think we'll cross that bridge when we come to it. Right now, it's a little too early to speculate. Right now, we're putting our trust in public health and all the officials and the science and the rest of that. So we're waiting to see what will happen. If and when that does happen, then we will make sure that the public has those vaccines available.
Okay, good. And the other question with regard to what's going on in relation to COVID, are you doing elective surgeries again, or has that stopped, or what?
We are doing elective surgeries. A great question. For a while there, we did pause last summer. Was actually had to do with a state mandate in terms of elective surgeries. Once we got through that period of time, we opened them up. We've been extremely busy with our elective surgeries in our procedure center. So everything's kind of back to normal as it relates to our service offerings. But of course, we have a lot of other measures in place with masking and social distancing and screening and those type of things to ensure the safety of our patients and employees.
And has, we've heard in a lot of areas that staffing has become an issue, both in the medical field and across the board. Is that a problem for us at all here?
It is a problem, and it's interesting to note that as I talk to other businesses in the community, I'm also a member of the St. Croix Economic Development Corporation Board. So we talk about these types of indicators important for the community. And what we're finding is that predominantly in our entry-level positions, and I won't give examples of that, but it seems to be harder to recruit in those areas in terms of our caregivers, and we'll talk about this hopefully during the segment, ramping up our primary care service offerings and such. We're not having much difficulty recruiting professional caregivers or clinicians, but those front or those entry-level positions seem to be a little bit harder to find, and that seems to be consistent across the community.
Yeah, that does. Moving on, before we get to the things that are the new things that are coming on board with Hudson, can you talk to a little bit to what being a Health Partners affiliate hospital means for community healthcare? We're used to I remember the days doing the 50th anniversary of the hospital when it started in 1953 when I was with the newspaper, and some people are a little fearful of what they call, for lack of a better term, corporate care. What what's your take on that, and what improvements? And you've obviously seen it from a variety of these, from Allina and Mayo and all of those as well. So your experience speaks well to this. What's better because of that?
Boy, that's there's so many pieces to that. First, I would say we are just so extremely proud to be a part of this community. We've been here for 68 years and as a major employer in the community. And like I said earlier, I've just seen tremendous growth just in the 4 years that I've been here. I think with Hudson Hospital Clinic being part of a larger integrated healthcare system, being health partners, it means we have a deep bench of experts in a variety of specialties. We want to make sure that Hudson has convenient access to a broader continuum of care. Being an affiliate of health partners also means that we can provide a more affordable and integrated care that I believe is close to home with quick, easy access to an array of specialists in the region. It's one of the reasons that we're expanding our primary care service offerings at Hudson Hospital Clinic here. Our specialty care has been growing. What it does is it really enables us to be more than just a community-based hospital. We have access, as I said, within the Health Partners Network, within the Valley system, with New Richmond, with Stillwater, with Amory. We're able to really provide that convenient care that's close to home with one medical record, with one bill, and access to all the specialists. There's really all the levels of care that anyone would need in this community is right here in the community. And I think our emergency department, hopefully we can get to that in a little bit, is certainly a flagship service line of ours here. We're anticipating we'll see about 11,000 patient visits in our emergency department here with level 1 trauma certified physicians. So having that in our community with a full array of services, all the care that's convenient, close to home, I believe that really is what is most beneficial for the community.
And is there, Tom, any kind of community input in terms of how the hospital is operated, or, you know, giving people some kind of ownership or buy-in to the hospital?
You know, Meg, I'm so glad you asked that, because we are here for the community, because of the community. The only reason we exist is because of the community as a nonprofit organization. With that in mind, we take it very seriously. It's a high priority of mine in my role. I try to be engaged as much as I can in the community, and I'm on a number of boards. And with that being said, we're continually soliciting input from our patients. We do surveys. We also have focus groups when we're looking at expanding any service lines here or doing any remodeling on campus here. We get the input directly from patients who would be using those services in terms of design and flow and access and questions and those type of things. We try to customize and cater our service offerings to what's important to our patients and what they're telling us, not what we think that they should have, but what they're telling us they want and what they need to have.
And that's an important thing in Health Partners. When you go into affiliate with a hospital, that you maintain that community connection. Absolutely.
You know, like I said before, it's all about the community. We have a number of extensions in the community, a number of different groups, and we also do a lot with sponsorships. We also do a lot with volunteering in the community. Just about any community event, you'll find representatives from the hospital and clinic, just because we're so proud to be a part of this community. And we really do consider it to be an extension of our family here at the hospital. The other thing is we're very focused on our community health. And we're also in the Healthier Together Coalition. We do a lot with health equity. And there's a number of programs, whether it be Make It Okay, whether it be Power Up, whether it be through partnering with our local school districts. There's just all sorts of examples where we're partnering in the community because we want to be viewed as part of the community.
Right. Good to hear. Let's talk a little bit about that emergency department and what you guys have planned. You know, is the demand for service in the emergency department increasing?
Absolutely. And, you know, I want to say again how proud we are to have this emergency center here in our community. It really is state of the art. We've expanded and remodeled our emergency center at the hospital here. We opened it up in June of last year. The amazing piece of that is we did it right in the midst of the pandemic, but we were successful in doing so. The project did double the size of our emergency center to 12 beds. It provided behavioral health friendly rooms. It improved our patient flow. It created more waiting room space. And really, I think just an overall better experience for our patients, our providers, our staff. It's important to note, as I said, that our emergency center physicians are all level 1 trauma certified. We are a level 4 trauma level ED here in our community, given the size of our community. But we have level 1 trauma certified physicians. They can handle anything that comes into the emergency department. We also have implemented a behavioral health crisis televideo program that supports 7 area hospitals. And we also now have a fully accredited stroke program, which is literally saving lives for people who present with stroke symptoms here close to home, right in the community. So demand for emergency care, it has been impacted by COVID, but I do want to mention that we didn't expand our ED because of COVID, but in hindsight, I think we're really fortunate that we had done so, because now that we have this state-of-the-art expanded and remodeled ED, it really has served us well throughout the pandemic. And the demand is increasing. As I mentioned earlier, we're looking at exceeding close to 11,000 patient visits in the ED. For a community of our size, that's amazing.
That is, yeah. Can you speak a little bit to, some people were concerned when we lost or when St. Croix EMS when we made that transition to Lakeview. Has that worked? Talk a little bit about how that's worked out.
Yeah, I think first and foremost, going back to your earlier question, we wanted to make sure that any steps that we took, any measures, any service related changes, that we were listening to the public, that we were responding to what the community needs. So we've always taken the input from the community very seriously on that. Since we implemented the new emergency or the new EMS building here on campus, it is run by Lakeview Hospital. It has been doing a fantastic job. I've heard nothing but positive things in terms of the level of service. And I'll be honest with you, having them that close to us here at the hospital, it certainly does, I think, play well for our patients and for the community. But I just can't give enough accolades to our partners at Lakeview Hospital who run the EMS services. I think it has been, I won't say it was without its transitions, but I think it's been a very successful transition. It's been a very successful program. And I'm hearing nothing but positive things. And I want to give credit where credit's due. The folks at Lakeview Hospital who run EMS here on our campus, they serve the community well, and I know the community is their #1 priority.
Absolutely. You're also talking about adding specialty care, some more specialty care services, as well as expanding primary care. Let's talk, which one do you want to talk about first?
Let's talk about primary care.
Okay.
I'm really, really excited about this. So at Hudson here, we've grown a lot since I mentioned here in the community. If you look way back to the 1950s, no comparison, right? So we've grown a lot since then. Together with health partners, Hudson Hospital Clinic, we made significant investments to keep our healthcare convenient, affordable, close to home. And we want to make sure that it is close to home for our primary specialty and hospital care patients. So as part of this ongoing commitment to meet the growing needs of the community, I'm really excited to share, and we've shared this before through press releases and other venues, that we're in the process of expanding our primary care service offerings here at Health Partners Hudson Clinic. The newly expanded and remodeled primary care clinic on the current hospital campus will be located on the first floor of the North Wing building. It will be open in May of 2022 to make room for the expansion of the primary care clinic offerings. We're going to be moving our cardiac rehab, our pulmonary, and our physical therapy service lines from the first floor to the second floor of the clinic. That has been communicated to our patients in the community. We're also recruiting now for new primary care physicians and advanced practice clinicians to join our family of primary care physicians, and in particular our internal medicine physicians. So we're excited about this growth. We believe it's good timing for the community. So we're expanding our service lines in primary care. It'll be a brand new area within our hospital campus for those primary care visits to occur. Our continued growth and investment in primary and specialty care right now, ensuring the process for making appointments is simple and convenient. That is a top priority for us right now. That's why we've also added options right now for online scheduling, for mobile check-in. We've got televideo or video service offerings in place. And we ultimately think that'll be a more enhanced patient experience. So a lot of things happening, but again, it's all just to make sure that we can meet the growing demands and needs of the community. And so this new primary care expansion will be in place. It'll be opened up in May of next year. And I just have to comment here, as I had wrote down here, I think it's one of our guiding principles, making care simple. And we can't think of a better way to do that than making sure that our services are available right here on the campus in an integrated, convenient way.
How many primary care Physicians. And could you maybe just speak to what we mean by primary care versus specialty care so that
Sure.
people know what we're talking about?
Yeah, primary care would be the traditional family practice physicians
Okay.
or advanced practice clinicians. It also includes our internal medicine physicians. Our internal medicine area, by the way, at Hudson Hospital Clinic here has grown over 55% in the past year alone. There is tremendous demand right now for quality family practice. So that's what we mean by family practice or primary care. It's kind of more of a general term for that.
Okay.
And you had asked about how many primary care physicians. So the interesting thing is with our partnership with Hudson Physicians here on campus for over 20 years, right now they provide the predominance of the family medicine physicians. And we then provide internal medicine, primary care service offerings. And we are now going to be growing those primary care service offerings to be within the Hudson Clinic as part of Health Partners.
Okay. And then specialty care.
Yeah. Specialty care, just like primary care has been growing, we've expanded and improved our specialty care access for areas such as cardiology, nephrology, rheumatology. We've also opened up a new dermatology practice here, which, by the way, has grown by over 255% is what I remember seeing within the last year and a half. So again, a tremendous demand for dermatology. We're really proud of how that clinic has taken off. We've also launched as I mentioned, better access in terms of video visits, mobile check-in, online scheduling. We think that's had a really positive impact on our access. So we're expanding our primary and specialty care services. I think that's an important step to keep our care local and convenient. Our birth center, by the way, is on target to deliver over 600 babies here at the campus. That's amazing if you think about it. In a community of our size. So we're really proud of that. We've also seen tremendous growth with our surgeries and our procedure center, our orthopedics, our lab imaging pharmacy, our infusion center, our rehab services, our programs for change, which is, I think, a flagship service line here for behavioral health and addiction counseling. It's all outpatient here, and other services. So we're seeing a growing demand. I think we're meeting that demand. So not only are we growing our primary care service offerings, but we're keenly aware of the need for specialty care as well, and we're responding that way as well.
The mental health piece is an important one that we've all heard a lot of talk about lately, and I'm certainly familiar with programs for change, but you've expanded that. You mentioned earlier that in the emergency room department, you have rooms that are behavioral health friendly and that kind of thing. Can you speak a little bit to the emphasis that you've put on mental health and behavioral health?
Yeah, absolutely. You know, when we're talking about community before, one thing that we've discovered through our focus groups, and we do a lot of research in the community, getting input for what we call our community health needs assessment. And that's something that we work with other healthcare systems, other hospitals in the area, but within Health Partners here, we're really focused on, again, what are the needs in the community? Everything from food insecurity to, as we're talking about now, behavioral health. So we make that a priority. And so our programs for change has been a long-standing practice here in the community that has been growing. And we believe we have one of the best programs around. In addition to that, we have what I mentioned earlier with our crisis behavioral health televideo services. When patients present to the emergency department and it's evident that they may have a behavioral health crisis going on, we make sure that we can provide the resources that they need for that. We have a number of other things that we're doing in terms of therapy and outpatient services. We have our inpatient services in Amory as part of the Health Partners Network. There's a number of other things that we're looking at in behavioral health, but the common denominator is we're responding to the needs of the community. It's an important priority for the community. And our behavioral health is, again, I think, really just a flagship service line here because we're doing so many important, highly impactful, meaningful things in that realm for our patients in the community. And even through our social services programs, we see that there's a lot of families or people in the community who might need some extra help, who might need some referrals, who might need additional resources. Our foundation has been doing a lot of tremendous work with our Good Samaritan Fund and partnering in those areas that I just mentioned. So it's really a coordinated effort. And that's one of the beauties, I think, of being in an integrated system like we have, is there are so many pieces to it, and we're all working in coordination to make sure that we can meet all the needs of the people in the community. And it goes beyond just physical, it's spiritual, it's mental, it's behavioral health, it's all those pieces. And I think we're well positioned to keep meeting all those needs moving forward.
Absolutely. No, I can see that. Can you talk, you mentioned earlier Hudson Physicians, and that I've lived in Hudson since 1989, and I remember being kind of confused that Hudson Physicians was totally separate from Hudson Hospital, and but they were in the same buildings or whatever. And that's all going to change now. Can you speak a little bit to that and how that works out in terms of services to people?
Certainly, I'll speak at a high level here. Maybe I'll start with Hudson Hospital Clinic. As I mentioned, we're part of a larger integrated healthcare system with health partners. So this means that we've got, as I said earlier, a deep bench of experts right now in different specialties. And that's why we're looking, I think, at expanding our growth at Hudson Hospital and Clinic here. Hudson Physicians is a different organization. I think it's important for our viewers to understand that. They do lease space from us. They've done so for several years, although they have not provided us with official notice that they're moving off of our campus. We know that they've announced their plans to build a new medical facility across the highway. I think, as it relates to Hudson Physicians' plans, I think they'd be better suited to answer that. What I will say this, since I can't speak on their behalf, is that I think we've had a great partnership with them. In fact, I know we've had a great partnership with them for over 20 years. Even though our relationship is changing right now, our shared commitment to meeting the healthcare needs in the community, that will not change. So we will continue to partner with Hudson Physicians. We will continue to work with them. We'll continue to collaborate. We're here for the same reason, which is to take care of our patients in the community. As it relates to their plans for building off campus, I'm not a spokesperson for them, so I would recommend that we ask them directly. But again, I want to emphasize that we are partners of theirs, and we will continue to be partners of theirs.
And that space that they have leased from you, that's where you're going to be making some of these changes in terms of primary care and that kind of, and PT, I think you mentioned.
Yeah, I want to be cautious here. They have not given us notice yet that they're moving off campus. I think it's pretty evident based on
the bulldozers are telling the story.
But some of it, to be honest with you, is technicalities as it relates to leases and things like that. So I don't want to misrepresent that. So the space that you're referring to that they currently lease is a significant portion of our building here. So I think it stands to reason that assuming that they were to give notice, that at that point in time, we will look at our master facility planning. But the plans that we have going on right now for expansion and remodeling do not include anything that they would be vacating in their space. So again, we haven't received notice from them, so I don't want to comment on that. Go ahead.
But you won't be expanding the basic footprint of the hospital in the near future?
No, it doesn't look like we'll be doing that. We are looking at our master facility planning, but we're not ruling anything out. As demand for services continues to increase, we will keep all options on the table. Certainly the Hudson Physician space is something we want to look at some point if they do decide to leave the campus. And so, yeah, there's a lot of pieces of the puzzle right now. But out of respect for our partners at Hudson Physicians, I don't want to say anything further. I'll let them speak for themselves.
Yeah, understood. Yeah, I think because people, like I said, people get sometimes confused, and they were, somebody said to me, is the hospital moving across the highway? And I said, no, I think we'll, and I said, I spoke to this exactly to our interview. I said, I think we'll get that clarified. So I think we have done that. Before I let you go, one of the things that has always been a part of Hudson Hospital in all the years that we've lived here and all the years the hospital existed has been volunteerism at the facility. I'm sure COVID impacted that. Where do we stand with volunteers and what volunteers can do for the hospital?
Yeah, it was one of those gut-wrenching decisions we had to make during COVID. We do have over 80 volunteers here at the hospital, and just part of our family. We just think the world of them, and it's just a great relationship. Most of those volunteers, I would say the majority of them, are still not coming back to volunteering here at the hospital. We want to make sure that we can take every safety precaution that we can before they're coming back. And we've been able to kind of get by. We certainly miss them. But I'm hopeful within the next couple of months, as the trending continues to decline for COVID cases and such, and as we can start to, at someday, as they say, get back to that new normal with our precautions, that we can bring back our volunteers. But unfortunately, we have not brought back our volunteers yet. We've had in a couple of instances where it was a mutual fit, but right now it's still on hold.
Understood, understood. And before I let you go, I think because of your long history in hospital administration and leadership, I would be remiss not to ask you, having been through COVID and probably a once in a lifetime thing for a lot of us. I still remember taking polio sugar cubes, but that's my age showing. But could you speak a little bit to what you have learned through this experience?
You know, it's such an insightful question. I think when COVID first hurt, I was thinking to myself, wow, this is certainly going to be a milestone moment, because it really is going to start changing how we deliver care, how we think about delivering care. As I was talking with our leaders, they reminded me, and we talked about this, it was really going to be a defining moment for us all. So I think a milestone moment for healthcare, a defining moment for us as leaders. We have learned a tremendous amount. I think the one thing that I've learned most near to my heart is that there really is nothing we can't accomplish if we work together. There's a tremendous amount of ambiguity, a tremendous amount of challenge. Our partnerships with public health, with other healthcare systems, with other hospitals. We have daily huddle calls in terms of bed counts, in terms of where we can transfer patients. At a local and county and state and federal level, we've built new relationships, and we're all just really working collaboratively. When push came to shove, we all came together as one unified team, and that reinforced for me, I think, as a learning that wow, we can handle anything that comes our way. And I think the fact that we have accomplished what we have working together, I think that's just really exemplified that point.
Do you think telemedicine and doing things online with people and Zoom calls and stuff, will that part continue even after the COVID subsides?
I do believe so. Previously, there were some areas that were offering televideo services. Now we weren't doing that, and we said, well, gosh, we better give that a try, right? And we did, and we just found, hey, not only is it good for us, it's good for the patients in terms of access and convenience. And so, yes, I do believe that as an outcome of the pandemic, that some of the changes that we have made, including televideo services, will be there for the long run. And I think it's appropriately so. We worked out all the challenges, we've ironed out all the wrinkles, so to speak. And I think in terms of access and flow and what we're doing in terms of appointments and the things that I mentioned earlier, I think it's all really been a beneficial outcome of the pandemic. So there's always a silver lining,
Yes.
I think, and some of these changes that we've made that'll be around for a while, I think are a direct result of that.
All right. Is there anything I haven't asked you about that you want to comment on?
Oh gosh. No, again, just thanks for having me on your program. And just to put a plug out there, if anybody ever has questions or concerns, or if anybody is nervous, for example, about receiving healthcare, please reach out to your physicians. We do our best to make sure that we provide the safest environment possible. We have been awarded, time to put in a plug here, we've been awarded CMS's 5-star quality award for quality and safety. We have received similar accolades from Health Grades for our quality and safety service levels. Health Partners has been named the top 15 healthcare system in the country. So I guess my point in sharing that is priority one is safety. It's making sure we can deliver quality outcomes and do it in a safe, convenient way. And so if anybody has any concerns, I want to try to minimize those concerns. We've gotten through this pandemic so far. We have all the right measures in place, and I think we'll be okay.
Absolutely. I would be remiss not to plug my own physician, Dr. Lee, Dr. Japs Lee, and my PT person, Jessica Stoner. I've had excellent care through the COVID crisis, and as my knees go and everything else goes south as you get aging. So anyway, I thank you very much for being with us and taking the time to talk to us about these issues and make us all feel really good about Hudson Hospital and clinics. Thanks, Tom.
Thank you, Meg. Pleasure to be here.
You too.